Welcome to King Abdullah bin Abdulaziz University Hospital. Good morning. Today, we will conduct a video lecture regarding pressure injury. Just sit, relax, listen, and enjoy. Pressure injury, assessment, and prevention. Our main objective is to educate and prepare nurses to prevent the occurrence of pressure injuries. How? By proper assessment, early prevention, and a good health education to patient and family members. What is pressure injury? A pressure injury, often known as bed sore or pressure ulcer, is a word caused by pressure from staying in one position for too long. They can be very serious and can affect the quality of life for individuals. But with good healthcare services, it can be prevented. What are the factors that can contribute to the development of pressure injury? First is immobility or limited mobility, bladder and bowel incontinence, shearing and friction injuries, and others such as advanced age, malnutrition, obesity, excessive moisture, and use of diapers. Here are the common pressure injury sites, starting from head to toe: back of the head, ears, shoulder blades, rib cage, elbows, spine, sacrum, hips, trochanter, ischial tuberosity, knees, ankles, heels, and toes. Now, let's go to the classification of pressure injuries. Why we need to know how to classify pressure injuries. Pressure injury classification is a method of determining the severity of a pressure injury. A classification system describes a series of numbered stages or grades, each determining a different degree of tissue damage. The deeper the injury and the more extensive the tissue damage, the higher the grade number. Stage 1 pressure injury. There is an intact skin with non-blanchable redness on a localized area, usually over a bony prominence. Darkly pigmented skin may not have visible blanching. Its color may differ from the surrounding area. Stage 2 pressure injury. There is a partial thickness loss of dermis, presenting as a shallow open ulcer with a red-pink wound bed without a slough. May also present as an intact or open ruptured serum-filled blister. Stage 3. There is a full thickness tissue loss. Subcutaneous fat may be visible, but bone, tendon, or muscles are not exposed. Slough may be present, but does not obscure the depth of tissue loss. May include undermining and tunneling. Stage 4. With full thickness tissue loss, with exposed bone, tendon, or muscle. Slough or scar may be present on some parts of the wound bed. Often include undermining and tunneling. Next is suspected deep tissue injury. Purple or maroon localized area of discolored intact skin or blood-filled blister due to damage of underlying soft tissue from pressure and/or shear. The area may be preceded by tissue that is painful, firm, mushy, boggy, warmer, or cooler as compared to adjacent tissue. Unstageable pressure injury. Full thickness tissue loss, in which the base of the ulcer is covered by slough, or yellow, tan, gray, green, or brown, and/or a scar. The tan, brown, or black in the wound bed. Base of the wound cannot be visualized. Do you know that we can prevent pressure injuries or avoid further injuries? But how? Our team adapt and develop tools that can be utilized in preventing pressure injury. Have you heard about Braden scale? How well do you know of Braden scale? Braden scale for predicting pressure ulcer risk is a tool that was developed in 1987 by Barbara Braden and Nancy Bergstrom. The purpose of the scale is to help healthcare professionals, especially nurses, assess a patient's risk for developing a pressure injury. In KAAUH, risk for pressure injury development will be evaluated upon admission, when transferring patient, if patient condition changes, and patient from OR. Here are the three Braden scale tools for all inpatient. First of all, the neonatal or infant Braden Q scale for newborn to 30 days. Assess each of the 8 subscales and select the description for each category that best describes the neonate patient's current condition. The 8 subscales are general physical condition, mobility, activity, sensory perception, moisture, friction and shear, nutrition, tissue perfusion and oxygenation. Each of the 8 subscales is scored from 1 to 4. Calculate a total score which will be between 8 to 32 points. Patients scoring 20 or less are considered to be at risk. The lower the score, the greater the risk for skin breakdown. However, degree for risk is not with this tool. Once the patient is determined to be at risk, appropriate intervention should be implemented on the most at-risk scale. Secondly, the Braden Q scale for 31 days to 8 years old. Assess each of the 7 subscales and select the description for each category that best describes the pediatric patient's current condition. The 7 subscales are sensory perception, moisture, activity, mobility, nutrition, friction and shear, tissue perfusion, and oxygenation. Each of the 7 subscales is scored from 1 to 4. Calculate a total score which will be between 7 to 28 points. Patients scoring 16 or less are considered to be at risk. The lower the score, the greater the risk for skin breakdown. However, degree for risk is not with this tool. Once the patient is determined to be at risk, appropriate intervention should be implemented on the most at-risk scale. Lastly, the Braden scale for 8 years old and above. Assess each of the 6 subscales and select the description for each category that best describes the patient's current condition. The 6 subscales are sensory perception, moisture, activity, mobility, nutrition, friction, and shear. Each of the 6 subscales is scored from 1 to 4, except for friction and shear, which is scored 1 to 3. Reassess all patients on daily or between shifts from OR when patient condition changes by completing Braden scale. Calculate the total score which depends on the scale to be used. The lower the score, the greater the risk for skin breakdown. Patients scoring 15 to 18 are considered to be at risk. These are the 3 Braden scale tools to be used for inpatients. But how about the outpatients? Introducing to you is the new Outpatient Pressure Injury Risk Assessment tool to be used by the outpatient department, emergency department, and renal dialysis unit. It is a checklist where you need to ask your patients to determine if there are any causative factors that may put them at risk to develop pressure injury. If any of this above question is yes, initiate and perform Braden scale assessment and pressure injury prevention plan. If patient has stayed for more than 4 hours in OPD, ED, and RDU, the appropriate Braden scale for the patient should be done. Next that we want to introduce to you is the KAAUH pressure injury bundles, which are the following. K stands for keep the patient's skin clean and dry. A for appropriate and timely positioning. Second A is for avoid friction and injuries. U for use barriers against moisture. And H for hydrate and ensure adequate complete nutrition, and across of it is the nursing intervention that can be done. Now, let us look at our pressure injury prevention and nursing care management workflow process. We have workflow process for both inpatient and outpatient department. For inpatient, first is to review the patient's history. Next is to perform hand hygiene, don your PPEs and identify your patient. Then, perform head-to-toe skin assessment and include the appropriate braid and scale tool. And then, check if there are skin injury or lesion. If yes, identify the cause. Is it due to pressure injury or other cause? Next thing to implement wound assessment. Then, inform the physician and manage as per doctor's order. After that, carry out doctor's order and perform wound care management. If it is due to pressure injury, write a safety event report. Then, document. But if there are no skin injury or lesion, utilize the KAAUH bundles to prevent occurrence of pressure injury. Then, do skin assessment and reassessment according to our policy. Lastly, document. For outpatient, which includes OPD, ED, and RDU. First is you need to review patient history. Then, perform hand hygiene. Don your PPEs and identify your patient. After that, use our outpatient pressure injury risk assessment tool. If any of the question is yes, perform head-to-toe skin assessment and include braid and scale tool. Check if there is a skin injury or lesion. If there is, inform the physician and manage as per doctor's order. After that, carry out doctor's order and perform wound care management. Then, do patient and family education. But if there are no skin injury or lesion and patient is only at risk, refer to KAAUH bundles. And lastly, document. Thank you for listening from Pressure Injury Team.